This is a reading of 4,000 people who ate at Hardees near airport at risk for hepatitis A, county says, by Steve Harrison in the June 26, 2018, the Charlotte Observer. An estimated 4,000 people who ate at a Hardee's restaurant on Little Rock Road in mid-June are at risk of contracting hepatitis A and should get a vaccine as soon as possible, Mecklenburg's health director said Tuesday. Mecklenburg Health Director Gibby Harris said a recent 5-person outbreak of hepatitis A includes an employee at the Hardees near the airport. People who ate at the restaurant, including carry-out and drive-through between June 13th and June 23rd, are at risk. Harris said the county doesn't believe the person contracted the virus at the restaurant, but likely was infected elsewhere. The county worked with state and federal Centers for Disease Control and Prevention to identify the 5 new cases of hepatitis A since June 6th. One of those people worked at the Hardees and had limited contact with food, Harris said. Harris said the CDC has told the county that the vaccination must be given within 14 days of exposure to be effective. That means people who ate at Hardees on June 13th need to be given a vaccination immediately. The county is holding 3 vaccination clinics for residents. The clinics are open 8 a.m. to 7 p.m. Wednesday and 8 a.m. to 5 p.m. Thursday at the Northwest Health Department, 2845 Beatties Ford Road, and at the Southeast Health Department at 249 Billingsley Road. There will be vaccination clinics from 3 to 8 p.m. Friday at the Hall Marshall Building, 700 North Tryon Street. There also will be a clinic open at the Hall Marshall Building 10 a.m. to 3 p.m. Saturday. There have been 10 cases of hepatitis A, a liver disease, since April 20th, 2018. The CDC described hepatitis A as a liver disease caused by the hepatitis A virus and is usually transmitted through the fecal-oral route or eating or drinking contaminated food or water. Symptoms include fatigue, low appetite, stomach pain, nausea, and jaundice. Those symptoms usually clear 2 months after a person is infected, the CDC said. The county said there are several high-risk factors associated with contracting hepatitis A. Those factors include family members, caregivers, or people who have had sexual contact with someone who is infected with hepatitis A, men who have had sexual intercourse with other men, people who use recreational drugs, people who have traveled recently to countries where hepatitis A is prevalent, homeless people who aren't able to wash their hands frequently. Harris said the county has 6 cases in all in 2017. This year, there were 2 cases before April 20th and 10 cases since then. Harris said the employee is recovering and handled food in a limited way. She said the employee's last day at work was June 13th. With that timeline, the county determined a 10-day window for people who are at risk. Commissioners asked Harris whether the health department had the ability to close the restaurant. She said the county does not, and added that management appeared to be taking the issue seriously. The county said it first learned about the employee's condition Monday. Harris defended the county's decision to wait until 3 p.m. Tuesday to announce to the public. Harris said the county had to investigate how much contact the employee had with food before alerting the public. This has been a reading from the Charlotte Observer dated June 26, 2018. 4,000 people who ate at Hardees near airport at risk for hepatitis A, county says, by Steve Harrison. If you live in the Chesapeake, Hampton Roads area, but you traveled near the airport and ate at that Hardees, you can come to Women First OBGYN and get a hepatitis vaccine. Call right away if you think that you were exposed.
Approximately 5.3 million people in the U.S. have hepatitis.
Anything that affects the liver and causes inflammation, by definition, is a hepatitis.
Listen as Dr. Stacy Rizza breaks down the ABCs of hepatitis.
A is the first one, and that is the type of infection you get from eating contaminated water or foods. You could get very, very sick from it, but it doesn't go on to be a chronic infection.
Vaccines protect against hepatitis A and are especially important for children and travelers.
Hepatitis B is the second virus that was identified, and that is one that can cause a chronic infection. And we're fortunate that we have a very, very effective vaccine for hepatitis B.
Hepatitis C is transmitted from person to person through bodily fluids. The virus can cause liver damage and death.
We do not have a vaccine for it, but we have, in the last several years, very, very effective therapies to treat hepatitis C.
For the Mayo Clinic News Network, I'm Vivian Williams.